My name is Kate Carr. I'm one of the family navigators here at the St. Louis Arc. Today, I'm going to explain and define what an autism assessment, diagnostic assessment is, how to obtain one, kind of what to expect, and then what happens next. So, an ADOS assessment, which is the medical assessment for your loved one to get diagnosed with autism, is called an Autism Diagnostic Observation Schedule, which is an ADOS assessment. Typically, these are administered by clinicians to help understand and evaluate various communication styles and skills, how you socially communicate and interact with others, and imaginative use of materials. So the clinician might have a few different things on the table, or maybe ask you a random question about what you think. It'll kind of just depend on the clinician doing the assessment and the age of the person receiving the assessment. It is an activity based, so they might have different things there for you to do or to talk about. They might want you to read a story, a very, very maybe 2, 3 page story with visuals, and tell them what you got from that. It's again very person centered and will be dependent on who is taking the assessment, the age, and quite a few other factors. So, who can have an ADOS assessment? When can I? And then, kind of, what happens? So, anyone 12 months up and older to adulthood can access this assessment. The nice thing with an ADOS is they will accommodate people across the lifespan, and it involves various sections. So again, depending on the age of the person receiving the assessment, they may or may not go over certain things. And again, that is person-centered to make sure that the assessment is the most accurate and appropriate for you. And the nice thing with this is that someone with or without verbal communication skills can access this. So it does not matter how you communicate, the clinician will work with you. And then what to expect. So the clinician or provider will interview the person that has a suspected autism diagnosis, as well as the parent or loved one of the person receiving the testing. Now, if it is a child that's receiving the testing, sometimes staff will request the caregiver to be present during the assessment, might want to know some information ahead of time so that they can best support the child during the assessment. And then next steps, once your ADOS assessment has been done and results are in, the physician will talk to you about what they learned, what they found. And again, this is dependent on the age. So the child, it's up to you and the child, depending on the age, if you want them to be there or not, to review the findings, the level of autism, level 1, 2, or 3 that has been diagnosed, and then resources such as support groups, educational advocacy, school support, leisure, recreation, funding, the list goes on. And a lot of times, what will happen is they'll give you all those resources, and it's like, oh no, what's next? Feel free to reach out to an agency such as the St. Louis Arc. We have family navigators here to support through the lifespan. So if you're needing any support and you're not sure who to contact, we are here and happy to support you with whatever you need. So thank you so much.